Hey there, QD video, QD clinic, brought to you by RoomNow.live. Today's case, pushing for LDAS versus remission, low disease activity, or do you push forward all the way to remission? Our case is a 42-year-old woman who came to see me about 3 months ago. When she came to me, she had been off of all of her DMARD and biologic therapy. She had horrible psoriatic arthritis, psoriasis diagnosed in 2015, psoriatic arthritis, I think, soon thereafter. She's previously been treated with, where are those drugs? Methotrexate, Humira, Enbrel, Remicade, and I put her on Cimzia and Areva. She either couldn't respond or lost response or had intolerance of methotrexate. So when I saw her a little over 3 months ago, her CDAI score was 45. I think she had like 20-something tender joints and, I don't know, 16 or so swollen joints. Her CRP was 21 milligrams per deciliter. She was a red hot mess. And so we put her on leflunomide and certolizumab, which she wanted to go on, and unfortunately was the next choice in her tiered system with her insurance. And although I didn't have a lot of hope for it, she came back a month later or 6 weeks later, and her CDAI score had dropped to 11. She comes back another 6 weeks later, and I see her today, and her CDAI score is 8. What that really means is that she has 6 tender joints, 6 swollen joints, pain score of 1, and only 1 check mark on her modified health assessment questionnaire. So she's done much better. She's delighted in how she's doing. She's doing great, according to her, with her only problem being an ankle that's swollen and bothersome. That's another swollen joint not counted in the 28 joint count. So do we stick with the fact that she's real happy, that she's cut her clinical disease activity score by 75%. She's cut her CRP by 90%, but all these are still high and abnormal. My answer is no, you don't stop at LDAS, which she's clearly in, or close to being in. She's not in actually yet, not according to this, this score. Or do you push forward to get her in remission? Sometimes that's going to be obviously contingent upon how much damage and how much background pain and dysfunction the patient has from mechanical disease or prior antecedent inflammatory disease. Some people, you may never get to a remission number with a CDAI score of 3 or less. Her, again, she still has 6 swollen joints, including the ankle, 7 swollen joints. She has some tendonitis going on. She still has a high CRP. I think the idea is you still push forward. What are we gonna do? She's on leflunomide 20 milligrams a day. She's on Cimzia 200 milligrams every other day. She takes trazodone for pain. She's on 5 milligrams of prednisone twice a day. So one, we consolidate her prednisone to 10 milligrams a day. We gotta get her off prednisone. But what else can we do? Well, it happens again, her diagnosis is psoriasis, and she has bad skin psoriasis. That too is significantly improved, but now she's going to get the psoriasis dose excuse me, of Cimzia, which is 400 milligrams sub-Q, meaning 2 shots every 2 weeks, and we're going to do that until she's better. We're going to see her back again in 4 weeks or 6 weeks, and if she isn't substantially better, we're moving on to other and newer therapies. One of the two, leflunomide or certolizumab, is going to be dropped and be replaced by something else. That could be an IL-17 inhibitor, that could be an IL-23 inhibitor, that could be a JAK inhibitor. So we'll see, but I think the idea is you push to remission unless remission's impossible based on structural disease and chronic pain from other causes. I think that as long as someone has active synovitis, active inflammatory disease, yes, you go as low as you can go and you keep going. That's it for this QD clinic. I want to make a correction to yesterday's QD clinic, which had to do with medication reminders. I still stand by everything I said. I forgot to mention two really important reminders that are very actually effective today, and that is the use of either Siri on the iPhone. Siri, remind me to take my medicine every Wednesday at 5 p.m. or using the Google devices. It's Google Echo, or I'm sorry, Amazon Echo, or one of the Google devices. Amazon has Echo. Amazon also has Alexa, which you can get reminders recorded in and played back to the patient. So to use those modern devices also are useful adjunctive tools in getting patients to remind themselves to take medication correctly. We'll see you tomorrow.